My name is Norah Foster. I'm an orthopedic spine surgeon here at Premier Health. I moved to Dayton about a year and a half ago, born and raised in Dubuque, Iowa. From there, I went to undergrad at Lewis and Clark College in Portland, Oregon. I spent 2 years after college as a high school science teacher in Miami, Florida with a program called Teach for America. From there, I went to medical school in Iowa City, Iowa at University of Iowa Carver College of Medicine. From there, I went to residency for orthopedics at Duke University in Durham, North Carolina. From there, I went to New York City, NYU for spine fellowship. I was in practice for 4 years back at Duke and then came to Dayton. So I do exclusively spine surgery. So I was trained as an orthopedic surgeon. I still love the musculoskeletal system. It's why I went into orthopedics. I just love the way the body moves. Its biomechanics are just fascinating to me. And I think, just from an interest in a lifestyle, I love movement, and I think movement is medicine. And so how the body moves and why it moves and making sure it continues to move is really a passion for me. So part of me coming here was becoming the medical director of orthopedic spine surgery. So not only do I want to be a leader as a physician, but I think it's important as a female physician that our voice is heard as well. So diversity within our field is very near and dear to my heart because I experience it every day. And so I want to make sure that I help put people in the position where they can someday eventually get to where they want to be. People come in sometimes with neck pain, sometimes with back pain. The spine is designed so that the nerves run through the spinal column and they go out and down into the arms and to the legs. So sometimes someone will come in with arm pain or leg pain that actually is emanating from their neck or their low back. So it's not always within their neck and back. It sometimes is in the arms and legs that they're feeling symptoms. Sometimes people will come to me with what we call spinal cord symptoms. And those can be things like my hands feel funny, my handwriting's getting sloppier, having a hard time tying my shoes, putting my earrings in, having a hard time with my balance, and my walking is off. Those are subtler things. Most people go to the doctor because they have pain or something hurts. That's why most of us, are brought to the attention of some kind of provider. But sometimes it's the more subtle things that actually are coming from the spine. And that is one of the things I love most about spine is that there are functional improvements we can make in people's life and quality improvements that I think is somewhat unique to our specialty. My philosophy of care is I want to help patients meet their goals. So, for example, if someone has a herniated disc and is having terrible leg pain and they enjoy walking as a nightly routine, I want to help them with that so they can get back to their nightly routine of walking. I've got patients with grandchildren who say I can't get down the floor anymore and play with my grandkids, and I want to be able to do that. And so it's my goal to get them to that goal. Sometimes those goals are different depending on what the patient looks like, but that's always the reason why I come to work every day is to try to get them to their goals.